Officials facing tough decisions, including whether to impose vaccine mandates. We turn now to the governor of Maryland, Larry Hogan. Governor Hogan, thank you very much for being with us. As we've been reporting, this Delta variant is rising across the country. We saw in your state of Maryland, hospitalizations are up something like triple what they were a month ago. What are you seeing?
Well, so we're a little bit luckier than most of the rest of the country because we're one of the most vaccinated states in America. And, we've vaccinated 78% of the people in our state and nearly 94% of all of our seniors. So we were down to almost no cases and no hospitalizations, and it's gone up. We're concerned about it, but we're much lower than just about any other state. This Delta variant is of great concern to us, though. It's much more contagious. It's potentially, causes more serious illness. But right now, our big focus is just continuing to vaccinate those last few Marylanders, because right now, nearly 100% of all of our hospitalizations and deaths are people who are not vaccinated.
You are doing well with vaccinations, and yet you've announced you are going to be requiring state employees who work in so-called congregate settings with individuals who are vulnerable to be vaccinated. Tell us how that's going to work.
Well, we're concerned about our most vulnerable citizens. So people that are in congregate facilities, that are in our Department of Corrections and our juvenile services, our health department facilities, and in our veterans agencies where we're taking care of some, seniors and veterans in a nursing home. We want to make sure we've done pretty well with them. They're about in line with some of the rest of the population, but we can't take any chances. This is where we had all the problems early on, was with folks in some of those congregate facilities. They're putting folks at risk, and so we're controlling those employees who work for us and asking them to make sure that they get vaccinated, have a first shot no later than September 1st. And if they don't and can't show proof of vaccination, then we're going to require masking requirements and constant ongoing testing to make sure that they're not bringing the virus into our facilities.
As I'm sure you know, Governor, the governor of your neighboring state of Virginia has announced that he's going to require all state employees to be vaccinated or else to undergo rigorous weekly testing. Why not do that?
Well, Virginia is in a much different place than we are. The virus is much stronger, there are more cases, more hospitalizations, and a much lower rate of vaccination. So these are the first steps that we thought were kind of the measured response to take today. It doesn't mean we watch these things every single day, and if we feel other measures are necessary, then we'll certainly consider them and take action.
And what about mandating masking, Governor? You've been quoted as saying that you don't believe that works, and yet you now have. I'm reading today the city of Baltimore mandating indoor masking. Clearly, experts are saying masking is the way to protect people from this Delta. Why are you opposed?
Well, I'm not opposed. I was one of the first governors in America to require masking, and we just lifted our mask mandate back in May because of our vaccinations are so great. We don't have anybody our main focus is hospitalizations and deaths. We don't have any vaccinated people who are going into the hospital or dying. We have it fairly well managed because of the vaccines, but I'm not opposed to masking at all. In fact, we still strongly recommend that people who are not vaccinated should wear masks, particularly in indoor settings. And we provide the authority of all of our local governments and to make those decisions based on the metrics on the ground in their particular jurisdiction, following along CDC guidance. But we also support businesses' abilities to make those decisions as well. And our hospital systems and others are taking actions that we support.
But I guess what I'm asking is, in a situation like right now where you have the Delta variant posing this dangerous threat, why not go ahead and go back to requiring masking when everybody can transmit, including people who are vaccinated?
Well, from the beginning of this, we've always followed the science. We have a terrific team of public health professionals and epidemiologists, and we're following their advice every single day, and they're not advising that at this point in time because our numbers, our virus numbers, our positivity rate, our transmission rate, our hospitalization rate, and are all the lowest in the country. and our vaccination rate is the highest in the country. And so we are taking the steps that we think are important, and other states are in a much different situation than we are.
I do want to ask you about children in particular, Governor. The CDC's director, Dr. Walensky, said today that only 30% of children 12 to 17 are fully vaccinated. And this is at a time when you have, again, pediatric infectious disease experts saying we know children now account for something like 15 to 20% of new COVID weekly cases. And so children are vulnerable, not just children themselves as these cases go up, but also the ability of children to spread the COVID back to whoever they're living with.
Yeah, well, obviously we're concerned about our children. Again, we're, I think, the best in the country on vaccinating 12 to 17-year-olds. We haven't gotten to the point where we did with adults because they started much later, but we're well into the 60% of our 12 to 17-year-olds vaccinated. We're 18 and over. We're, one of the best in the country. But on the kids, we're doing great also. And while we are seeing more infections with younger people than we were earlier, we are not really seeing that translate into serious illness or hospitalizations yet, but it's something we're very conscious of and trying to keep a close eye on with this new variant, which everybody's learning more about as we go along every day.
So you're open to doing something more with regard to children, either requiring masking in schools?
Most of our school systems are requiring masking. Our primary focus is to try to make sure that we get our kids back in school because they've really suffered over the past year or so not being in school. We've had more than half of our school systems open for the entire year, all of our private schools and about half of our public school systems with almost very little cases or serious problems at all. This variant is different, and that's why, again, our duly elected school boards that have the power to make those decisions, and most of them are making decisions to require masks for the kids because they're really trying to get kids back in a safe way. We've also put $1.2 billion into our schools to help address filtration systems and HVAC systems that are going to help also to keep the kids safer.
All right, Governor Larry Hogan of the state of Maryland, thank you very much.
Thank you, Judy.